Hello viewers, I am Dr. Ruchira Ganachari working at Eledent Hospital. I am a dental surgeon and our branches are at KPHP and Kondapur. So today I am going to discuss with you about something called as bad breath, or in other words we call it halitosis. Usually a lot of patients or a lot of people walk in complaining about bad breath which they have. And now let's know how do we have to get rid of this bad breath, or the ways that you get to know that you have bad breath. Firstly, a person who is having a lot of bad breath issues, they lose a lot of confidence, they don't seem to want to talk much, or rather say they have a little bit of anxiety issues knowing that they have a bad breath coming from their mouth. But there are also another certain type of people who don't really know if they have any bad breath coming. That's when others play a role by telling them, you know what, there's a foul smell coming from your mouth, probably you should wash your mouth and some things like that. Now this has become a very sad reason for people who suffer from bad breath. They try to brush more than twice a daily, or say they try to chew in a lot of wind, or they use a lot of mouthwash. So they keep trying their own ways to get rid of this bad breath, but sadly all this wouldn't work and it would just make it worsen. So there are ways of how you could get rid of it, and now in this video further you'll be knowing on how you can get rid of it. But before that you need to know why does it even occur. So now firstly I will like to speak about the ways of why we start to have bad breath. Firstly, it will be because of any type of food that we eat. So when I'm telling food, it means anything that we consume, be it onion or garlic or anything of that sort. This causes a bit of foul smell which comes from the mouth. Secondly, if a person is on some kind of medication, there are certain medicines which tend to give you a bad breath. So that could be one of the reasons of why you end up having a bad breath. Thirdly, if we speak, it's about any systemic disorders. Doesn't have to be anything major. It could be as simple as having acidity issues. And then it comes to your teeth. Supposingly you have a tooth which is already decayed, or say you have some kind of food getting stuck somewhere in your mouth. This is another reason for why you might have bad breath. Or also if you have your teeth which are not placed in a proper alignment, or rather say your one tooth is placed above another, or things like that. That's when also you tend to have a lot of foul smell. So the only way you could get rid of all these smells or this type of problem is, firstly you got to go and visit your dentist. What a dentist will do is, firstly he'll check if there are any problems, or if there is any kind of a decay or any kind of a cavity present in your mouth. And then any dentist or any place you go to, first thing that they would tell you in a clinic is getting your teeth cleaned. And when you say cleaning of teeth, that doesn't mean that you don't brush your teeth well, but it simply means that it's professional cleaning, like how you would give your car for servicing once in 3 months or once in 6 months. That's how it is also with your teeth. You need to visit a dentist to make sure that he cleans your teeth with using an ultrasonic scaler. This is done not because you don't brush your teeth well, but also that there are certain areas that your brush might not be able to clean thoroughly. That's when a dentist plays a role to clean your teeth, and it's trying to solve all the problems that you have during your entire consultation with us. When we are telling that we are going to clean your teeth, that doesn't mean we just clean it and let you go. We clean your teeth, tell you what other issues are going on because of which you have this bad breath issue, and then we try and help solve it for you. Apart from this, when it comes to taking your medication, or somebody who is having health issues, they have to visit their general physician and try consulting them and try asking them that if there is another way of where you could change my medication because you are suffering from bad breath. That could be another reason of how you could get rid of this. So make sure that you visit your dentist or your general physician to make sure you do not continue to have this bad breath, and try visiting a dentist once in 6 months. Thank you for now.